Hi guys, welcome back to the channel. So this is basically the height revision or your MTR BTR part 3 guys. Okay, here we will be doing the remaining part of the first aid book. Also we'll be discussing all the physiology graph, how to make it easy so that you don't make the questions wrong. So we'll be starting, and guys, if you are new to the channel, please subscribe to the channel for such high yield videos. And so sorry for being inactive for the past 10 days since I had my semester exams. So let's get started with the high yield revision part 3. So first of all, we'll see few of the images guys. Okay, if you see this one guys, okay, what do you see guys? Here you see the presence of diaphragm has gone up guys. Okay, that is a congenital diaphragmatic hernia. So you have a hole in the diaphragm. As a result, the intestine have gone up. So what is the most common type? That is your Boca-Deloc type. Okay, that is your posterolateral variety. Okay, Boca-Deloc is the posterolateral variety of the congenital diaphragmatic hernia. This is important. And bag and mask ventilation is strictly contraindicated. Okay, this is very important. Now coming on to your omphalocele and gastrochysis. See, these two are frequently confused topic. Okay, what is omphalocele and what is gastrochysis? So this when it is covered with a sac around it, that is omphalocele. When you have no sac, that is your gastrochysis. Okay, so gastrochysis does not have a sac. Like if you can see guys, O is there means there is a complete sac around it. Here G is there means it is an incomplete sac, means you don't have a sac because it does not make it, there is no sac. Now remembering the Meckel's diverticulum guys. Okay, so when you think about the Meckel's diverticulum, so what is there at the antimesenteric border means you have the presence of a Meckel's diverticulum. So basically here you follow the rule of 2. Okay, so basically what can happen, that there can be either a gastric mucosa can be there, so there could be gastric acid production, there may be bleeding. So this is Meckel's diverticulum. This is important. This is found in 2% of the population. Have a look at the rule of 2. This may be asked in your exam. Now coming on to the chromosomal disorder, summarizing it. Okay, so see, Down syndrome, you have the trisomy 21 chromosome. Okay, now basically so this trisomy is 21%. It may also be due to mosaicism, okay, or translocation, Robertsonian translocation. See, what are the clinical features? You have epicanthal fold, up slanting palpebral fissure, you have macroglossia, okay, means large tongue. Then coming on to the associated disorder, this is associated with duodenal atresia, and duodenal atresia shows double bubble sign. This is again a frequently asked MCQ. Then this may be associated with ALL guys, again important. And which AML is associated? It's associated with AML M7, again MCQ. And the endocardial cushion defect, the most common defect in Down syndrome. Then coming to Edward syndrome, E for Edward, E for 18, that is trisomy 18. So what do you see in Edward syndrome? Okay, and Down syndrome also, see, we have your quadruple test guys, okay, which includes your beta SCG, which includes your inhibin, okay, which includes your alpha fetoprotein, and which includes your unconjugated estriol. So what are the things that are elevated here guys? Here beta SCG and inhibin are high. You can see H for high, HI for high. Okay, so beta inhibin and this alpha fetoprotein and unconjugated estriol are reduced. Again a MCQ that may be tested upon. Now coming on to the Edward-Wallace syndrome. See, Edward syndrome, the most important thing is this rocker bottom fate overlapping. See, R for rocker bottom, O for overlapping of digits guys, again an important thing that you need to know. Okay, and this may be also associated with congenital heart disease. Then Patau syndrome, that is trisomy 13. Okay, so trisomy 13 is Patau syndrome. So here you see the presence of cleft lip and palate and the polydactyly, again an important MCQ. Then Turner syndrome guys, here you will have 45 chromosome, means XO, means only out of the 2 X chromosome only one is there, hence the gonads will be streak ovaries guys. Okay, so what are the things that you need here important to know? That is strict ovaries, that is waving of the neck, and waving of the neck is directly proportional to the CVS anomalies, the congenital anomalies. Okay, then you have the short stature. This is important in your amenorrhea wala question guys. See, amenorrhea, widely spaced nipple, the nipples are far apart. Okay, this is important. And here this coarctation of aorta is the CVS anomaly seen. And here the child has a normal IQ, again important. Like in Down syndrome, IQ is reduced. Okay, so this causes means intellectual mental retardation, guys. Okay, intellectual disability. Then Klinefelter syndrome, that is 47 chromosome XXY, and here you see the presence of your microorganism. This is very important MCQ. Okay, that is a small wala thing. Okay, and this can lead to azoospermia, sterility, infertility. Okay, then coming on to a neurofibromatous one, that is located on chromosome number 17, and the gene in neurofibromin. Okay, and this is cafe au spot and neurofibromas, and also you see leash spots, guys. Okay, this is again important. Then coming on to a cystic fibrosis, guys. Okay, that is cystic fibrosis is due to mutation in CFTR gene located at delta F508 position. Again an important MCQ. Here what happens, guys, there is a problem with the sweat wala thing. Okay, so here if you see the diagnostic test is sweat chloride ka level more than 60 milliequivalent per liter. So when you have a defect, guys, there will be buildup of the mucus. As a result, there will be recurrent infection, sinusitis. Again a potential tested. This was this year NICT question. So again you need to know. Then coming on to meta imprinting disorder, guys. Okay, see, we have Prader-Willi region and we have Angelman syndrome. Okay, if you see the Prader-Willi region, okay, that is PDS. Okay, Prader-Willi. So remember, Papa region is deleted. Means when Papa is thing, normally what happens, one thing comes from father, one thing comes from mother. So here both of them will come from mother, hence it is maternal. So basically this Prader-Willi is a genomic imprinting where both you will come from mother wala thing. This is important. Okay, and see this Prader-Willi things, what are the things you need to remember for this Prader-Willi? So here the child is having obesity, hyperplasia. Why? Because due to increase in ghrelin. Okay, see, we have two hormone, guys. One is ghrelin and one is leptin. Okay, so we always get confused what is what. So ghrelin, okay, ghrelin makes you grow more, means you eat more, that is obesity. Leptin, that is thin wala hormone, guys. Okay, so this will make you lean. Then hypotonia and cognitive impairment. Okay, these are the things in a Prader-Willi wala thing. Okay, so the child is obese child. This is important, guys. Then Angelman syndrome. Mothers are angel, we say, guys. Okay, so that is here always laughing, happy puppet. Here we will have seizure. Okay, S for seizure, A for ataxia, R for retardation, and I for intellectual impairment. Okay, and frequent laughter, excitable personality, seizures. Okay, so this Angelman syndrome both are located on the chromosome 15. Also we have a Marfan syndrome located again on the chromosome 15. So this was about your chromosomal disorders in a nutshell. Okay, now talking about the congenital adrenal hyperplasia in a nutshell. Okay, see, we have 21 alpha hydroxylase, 11 beta hydroxylase, and 17 alpha hydroxylase, guys. Okay, so see, there is a very simple mnemonic that will help you remember, guys. Okay, so what the questions come basically, how do you identify a long stem question, whether there is presence of hypertension or not, and whether there is virilization or not. So remember, hypertension, guys. Okay, hypertension means 10 is coming, that is 1 is coming. Okay, guys, so if the first letter has 1, guys, okay, that will have a hypertension wala thing. Okay, see, both like this means this both has hypertension, guys. Do you see? This has 2, not 1. So hypertension is absent in 21 alpha hydroxylase. Now, so the other letter, guys, this indicates you about your virilization. Okay, if it is 1, virilization is present. See, virilization present, virilization absent. Okay, so and this 21 alpha hydroxylase is the most common time. Suppose we'll take an example. See, we are taking an example of 21 alpha hydroxylase, the most common wala thing. Okay, and see, this is the enzyme which is 21 alpha hydroxylase, guys. Okay, see, 21 means it's not 1 there, means hypertension won't be a feature of this one, it should be a 1. Then this is 1 means virilization will be the feature of this one. Okay, guys, now let's check it out, guys. So here you have the presence of virilization. Do you see, guys? Okay, and you have no hypertension. See, 11 beta hydroxylase. So both hypertension and virilization is present. And this 21 alpha hydroxylase is most common, guys. Okay, and here you have the here you have increase in 17 hydroxyprogesterone, guys. This is again an important MCQ that you need to know. This is again an MCQ. So this was about your congenital adrenal hyperplasia. Now coming on to the classical relevant treatments, okay, that will help, that can be asked as a like long stem question or a clinical hint based question. So let's get started with it. Okay, see, if someone talks about ethylene glycol or methanol intoxication, okay, so basically alcohol intoxication, so you give a fomepizole, that is alcohol dehydrogenase competitive inhibitor. We know alcohol gets converted by alcohol dehydrogenase, then with aldehyde dehydrogenase, so we are inhibiting the enzyme. Then if you have a chronic hepatitis B or C infection, guys, okay, so a chronic hepatitis B or C, that is interferon alpha, okay, is you, and also we can use a ribavirin as a treatment, or also for hepatitis B it's sofosbuvir. Okay, then streptococcus bovis, okay, this causes endocarditis in colon cancer wala thing related. This is very important MCQ that may be tested upon. Okay, this has also been previously asked, guys. Okay, now Clostridium botulinum. So if you see you have infant botulinum where the honey was thing, guys, try to correlate the thing, guys, that comes in your way. Okay, Clostridium botulinum, so human botulinum ka immunoglobulin is given. Clostridium tetani will cause tetanus, guys. Okay, we had two type of toxin in tetanus, guys. One was tetanolysin and one was tetanospasmin. Okay, so this tetanolysin and tetanospasmin, so which one act here, guys? This tetanolysin has no role, and this tetanospasmin causes the spasm of the muscle. Okay, so this is important. This is when you have a history of a child playing in the soil and through the wound the bacteria enter, it caused by Clostridium tetani, so we'll give antitoxin and we'll give a wound treatment. Now coming on to your Clostridium difficile, guys. Okay, so basically this causes, means antibiotic associated wala diarrhea wala things it causes, that is oral vancomycin can be given. Then Neisseria gonorrhea, guys. Okay, so this Neisseria gonorrhea, guys, we had this this was a kidney shaped organism, Neisseria gonorrhea, and basically it causes gonorrhea, that is sexually transmitted disease, Neisseria gonorrhea. So we'll use a third generation cephalosporin, that is ceftriaxone. Also, in order to cover chlamydia, guys, okay, we can add azithro or doxy, guys. Okay, this is in accordance to the STI kit wala, which we have already discussed, guys. Okay, so revise the kits also, that is very important. Then Neisseria meningitis. Okay, this Neisseria meningitis, okay, this basically causes meningitis. Okay, so this causes meningitis. So again this is an invasive infection, so we can again use a third generation cephalosporin, and this rifampicin is all given as a prophylaxis for contact people. Then Haemophilus influenzae type B. Okay, guys, see what are the things Haemophilus causes, guys? E for epiglottitis, M for meningitis, O for otitis media, and P for pneumonia. Do you see, guys, everything comes from the name. Try to use your sense, guys. Okay, that makes the paper so easy. So we can use amoxicillin plus clavulanic acid, also ceftriaxone for meningitis, and rifampin or rifampicin for prophylaxis. Again, very important and easy thing. Then Legionella pneumophilia, guys. Okay, so basically for Legionella, guys, we use macrolides group of drug, that is azithromycin. Again, an important thing. So basically here you have a history of AC vent wala things and other thing. Then Pseudomonas aeruginosa, most common cause of hospital acquired infection, like anything something like hospital acquired, or they will give the color wala history, guys. Okay, that is important. So basically for Pseudomonas, we can use some drugs like, guys, this is piperacillin tazobactam, again an important thing, guys. Then we can use a carbipinum wala thing, again tobramycin, aminoglycoside, this are the drugs. Then gentamicin, these are the drugs that can be used for Pseudomonas. Then Treponema pallidum, guys, we have here that it causes syphilis, guys. Okay, then we have here VDRL test used for diagnosis of syphilis. Okay, and the treatment is penicillin G. Very simple, guys. Then Chlamydia trachomatis. Okay, so this Chlamydia trachomatis, it can also cause sexually transmitted disease and also cause neonatal conjunctivitis wala thing. So for sexually transmitted disease, guys, we can use azithro or doxy plus ceftriaxone to cover for gonorrhea, and oral erythromycin for chlamydial infection in infant, that is through the eyes the infection may spread. Then Candida albicans, guys. Candida albicans is a fungi. Okay, so this will cause basically invasive and systemic infection, guys. So we can use the topical azoles, like vaginitis, we can use it, guys. Okay, nystatin. Okay, then you have caspofungin, you have fluconazole, amphotericin B for systemic or invasive infection. Then Cryptococcus neoformans, guys. Again, this cause disease, so again this is invasive, so we can use amphotericin B with flucytosine, and maintenance is fluconazole. This is very common infection in the AIDS patient. Okay, then Sporothrix scanchi, which is basically a rose gardener's disease. Okay, so rose gardener, so basically here what do you see? A sporotrichoid pattern of photo image will be given, and here potassium iodide is used as a treatment. Also I for itraconazole and oral potassium iodide. Again, this is important. Then pneumocystis cerevisiae. here this causes pneumonia in matlab basically immunocompromised patient. So when you see the stain, guys, here you will have crushed ping pong ball wala appearance, green colored photos, if you can recall, guys, from the fungi division. So here we use trimethoprim and sulfamethoxazole combination in a immunocompromised where the CD4 count is decreased. Then toxoplasma gondii. So this toxoplasma gondii, guys, okay, so this here we use sulfadiazine and pyrimethamine. Again, an important MCQ that you need to know for toxoplasmine. Okay, this is also must know information. This toxoplasma, this is basically transmitted by cats. Okay, then malaria, we have anopheles, various species of anopheles, guys. Okay, this is important again. So malaria, guys, how do we give malaria, guys? Basically for like normal Vivex malaria, we use chloroquine plus primaquine ka combination. So chloroquine is given for 3 days, that is 10 mg per kg on day 1, 10 mg per kg on day 2, and 5 mg per kg on day 3, followed by primaquine 0.25 mg for 14 days, guys. That was normal malaria. If there is like falciform, guys, then depending on the eastern state and northeastern state, guys, we can either give artemether lumefantrine combination in northeastern state. Other than northeastern state, guys, we use means this one, sulfadoxine pyrimethamine wala combination. This is again important thing that you need to know, guys. Okay, and this primaquine is for relapse wala case, for liver hypnozoids, that is, and this hypnozoids are seen in, guys, vivax and ovalka infection. Again, an important MCQ. Then trichomonas vaginalis. If you remember, guys, this comes under the KIT2 infection. That is, what was the color of KIT2? Green color. Green is safe food, guys. So here we can use secindazole and fluconazole, guys. And this fluconazole was for fungus, guys. That is secindazole, metronidazole are here it is used, guys. Then streptococcus pyogenes, guys. Okay, so that is streptococcus group wala, so penicillin can be used. Streptococcus pneumonia, guys, again penicillin may be used, guys. Staph aureus, guys. Okay, so first of all, guys, if it is methicillin sensitive as aureus, guys, we can use nafcillin, oxacillin. If it is MRSA resistant, means methicillin resistant, so we can use vancomycin, daptomycin. Okay, and if it is resistant, vancomycin, daptomycin. So enterococci, guys. Okay, so this enterococci, guys, this grows in 40% bile is agide agar. Here we can use vancomycin, again important. Rickettsia, guys. Okay, so this rickettsia mainly it is the doxycycline, already discussed in the rickettsia wala video. Then Mycobacterium TB, guys. Okay, remember the HRJD. H for isoniazid, R for rifampicin, Z for pyrazinamide, E for ethambutol. 5, 10, 25, 15 mg per kg. Again important. Recurrent UTI prophylaxis. Again we will use co-trimoxazole, that is trimethoprim plus sulfamethoxazole ka combination. Influenza. So here you have neuroamidase inhibitor, that is oseltamivir, zanamivir. Also we have a drug that is rimantadine. Again, an important MCQ. CMV, guys, we try with ganicyclovir, and if this is resistant, guys, we shift to foscarnet. Then this cytomegalovirus was basically the aula inclusion wala thing, guys. Again, important. Then HIV pre-exposure prophylaxis, guys. Okay, so here we can use tenofovir, limivudine, okay, and dolutegravir, guys. Initially, efavirenz was used with in the recent guidelines last year. They changed it to dolutegravir. Okay, so tenofovir, lamivudine, and dolutegravir. Then patent ductus arteriosus, guys. Okay. So basically there is a communication between the aorta and the pulmonary artery. So we close with NSAIDs, that is endomethacin. Okay, and keep open with PGE analog, that is misoprostol, helps you keep it open. If there is angina, guys, sublingual nitroglycerin, this is very important. Every one of you knows this already. Now coming on to the other ones, guys. Hypercholesterol means there is increase in blood cholesterol levels. So basically we can use the statins. That will help to reduce. Statin is the first line drug in the treatment of this. Okay, then hypertriglyceridemia. Triglycerides are more, so drugs like fibrate, fenofibrates can be used, guys. Okay. Okay, and here statins like pembastatin, many statins are there, guys. Read your pharma wala notes. Arrhythmia and damaged cardiac tissue, guys. So we use class 1B antiarrhythmic. Okay, that is lidocaine, mixalatin. Okay, the mnemonic for class 2 is leave PMT. Okay, class 1 is QPD. Okay, quinidine, procanamide, diisopyridamole. That is class 1A antiarrhythmic. Okay, Now coming on to prolactinoma. So basically prolactinoma is a tumor, guys. Okay, pituitary ka tumor hai. So prolactin, what will happen? So basically here we give dopamine agonist in your prolactinoma, guys. Okay, because there is excess of prolactin here, guys. Okay, that decreases the dopamine. So we need to increase the dopamine. Diabetes insipidus, guys. What happens in diabetes, guys? We have decrease in ADH. Okay, when there is a decrease in ADH, okay, so what is the work of ADH, guys? ADH inhibits the loss, antidiuretic hormone, prevent the loss of water. When ADH decrease, there will be loss of water in the urine, guys. So body water will decrease. As a result, serum osmolarity will increase in ADH. So we use a desmopressin, that is a synthetic analog, and if it is due to a nephrogenic cause, where it is due to ADH resistance, where we can use your amiloride or hydrochlorothiazide, again important. Okay, then SIADH, guys, increase in ADH thing. ADH increase, तो क्या होगा? It will absorb more water, means less amount will go in the urine. मतलब due to increase in more water, body का total water increases, guys. Okay, so serum osmolarity reduce. But if we think about the urine, guys, okay, and here so this is important. If we think about the urine, guys, so basically due to increase in ADH, guys, this your renin angiotensin wala thing is not getting absorbed. So what will happen? Your sodium will not absorb from the urine. As a result, sodium will get excreted out in the urine. Therefore urine sodium is more than 20 in your SIADH. Again a PYQ, guys. Okay, and the question will give you here the question will be your polyuria, oliguria, guys. But why? Because H2 is absorbed, so less amount of urine, guys. That is oliguria in the question. Okay, less amount of urine will go. Okay, so here we can use SIADH, and here that is the agonist, that is tolvaptan, guys. Okay, that is VH2 ka receptor. Okay, again important. Then diabetic ketoacidosis or hyperosmolar hyperglycemic coma, that is insulin and potassium, guys, and IV fluids to maintain airway circulation, guys. Pheochromocytoma, guys. Here we use two drugs, guys. Okay, pheochromocytoma basically is a tumor of adrenal medulla, guys, that releases excess of catecholamine. So during surgery we need to control the release. As a result, we use alpha antagonist followed by a beta blocker, that is phenoxybenzamine followed by like phentolamine or something you can use, guys. Then carcinoid syndrome, guys. Carcinoid syndrome is due to excess 5-hydroxyindole acetic acid. Okay, when there is increase in 5-hydroxyindole acetic acid, guys, so this will cause systemic flushing, vasodilation, other things, guys. Okay, so octreotide may be tried here. Then diabetes mellitus type 1, guys. Okay, so that is due to basically insulin replacement. Okay, deficiency in insulin. Diabetes mellitus type 2, that is due to insulin resistance wala thing. So hypoglycemic agents may be tried. Insulin, if it is done, if does not works, guys. GDM, gestational diabetes mellitus, that is seen during the case of pregnancy. Okay, when there are high sugar level during the pregnancy, that is your GDM. Okay, so that is dietary exercise, that is, this term is known as MNT, medical nutrition therapy plus insulin, guys. Okay, then Crohn's disease. So steroid may be given, why? Because it is due to basically immune regulation disorder, guys. Okay, then infliximab, that is TNF alpha inhibitor, guys. Okay, we have also drugs like golimumab, adalimumab, okay, and azathioprine, again immunomodulator, guys. Ulcerative colitis, here we use a 5-amino salicylic acid ka preparation, that is mesalamine, olasalazine, again important, infliximab, or you can do a colectomy. The treatment of choice is total protocolectomy with ileoanal pouch anastomosis, guys. Okay, see, ulcerative colitis, guys, C is continuous involvement, O means often rectum involved, L means lead pipe appearance, I means increased risk of toxic megacolon, increased risk of cancer, guys. Okay, this is important, and this was lead pipe appearance. If we talk about the sister Crohn's disease, guys, the mnemonic is sister MAC. Okay, so what do you see in the sister MAC, guys? Okay, this was the transmural involvement, guys. This sister MAC, transmural rectum is often spared, guys. Here, okay, here you see the aphthous ulcer. Okay, on microscopy you will see the presence of granulomas, guys. Okay, so that is your Crohn's disease and your ulcerative colitis wala thing. That is important, you need to know. Then coming on to the sickle cell disease. So sickle cell disease, what happens, guys? Glutamic acid is replaced by valine at the beta chain ka 6th position, guys. Okay, So when there is a replacement, it does not means make the normal hemoglobin. So basically you need to increase the fetal hemoglobin because it has high affinity. So you will give hydroxyurea. Then CML, chronic myeloid leukemia, guys, that is translocation 922. That is Philadelphia chromosome that is detected by the Fischweiler technique, that is fluorescent in situ hybridization. Okay, so this chronic myeloid leukemia, guys, here what we do, guys, we include here basically this translocation 922 is between the BCR and ABL, guys. BCR means the breakpoint cluster region, ABL means the epsilon gene. So basically here you use the tyrosine kinase inhibitor like imatinib, also used in GIST, guys. Again, a very important thing that you need to know. Okay, now coming on to this, guys, acute promyelocytic leukemia, APML, that is AML M3. Okay, remember M3, 3 letter, that is this is associated with DI. See, this cell shows the presence of faggot cells, that is crisscrossing of OR rods is known as the faggot cell. Okay, and this translocation 15 M3 has the translocation, guys, translocation 1517, that is PML. And RARA means retinoic acid receptor. Okay, so this RARA is only used for treatment, that is all trans retinoic acid and your arsenic trioxide AS2O3. Again, an important MCQ. Okay, then if there is a immediate anticoagulation, guys, we use heparin. In pregnancy, that is low molecular weight heparin, LMWH, guys. Okay, immediate anticoagulation heparin. Long term anticoagulation, guys, we go with warfarin and dabigatran, guys. That is a only oral direct thrombin inhibitor, guys. Okay, this is again important. Okay, then see heparin ka reversal, guys. This is a very frequent MCQ. That is again, that is protamine sulfate. And warfarin ka reversal, that is vitamin K. Vitamin K is important for clotting factors 2, 7, 9 and 10. Again, a frequently asked MCQ. Then dabigatran reversal, guys. Remember dawai, and here you remember daru. Okay, that is idarucizumab. That is dawai and daru goes hand in hand, guys. Okay, dawa and daru goes hand in hand. Then direct factor 10A inhibitor reversal, guys. Okay, so you have adnexate alpha XA. Do you see, guys, adnexate alpha? Then HER2 receptor positive breast cancer. This is very important. Trastuzumab. I think this everyone knows. One of the three can be asked. This is a frequently asked question. Then hemorrhagic cystitis from cyclophosphamide, ifosfamide. These two drugs are used in cancer and all. So this treatment is MESNA. Again, a frequently repeated question. Then nephrotoxicity, like from platinum compound like cisplatin, carboplatin, guys, we use amifostine. Okay, cardiotoxicity from anthracycline, guys. Okay, so here we use dextrazoxone. This guys, this all of the things has been discussed in my like immunomodulators and cancer wala chapter. If you are having the doubt how to remember, go and see from there. Myelosuppression from methotrexate. So we know methotrexate is a dihydrofolate reductase inhibitor, and also this has a problem with the liver toxicity, guys. So before starting this, you need to monitor the hepatic liver function test, guys. That is leucovorin, guys. Okay, that is a folic acid analog. Then osteoporosis, guys, where there is a decrease in bone mass density. So we need to increase it. So we can either give calcium vitamin D, we can give bisphosphonate, we can give selective estrogen receptor modulator, calcitonin, and this denosumab, guys. This one is a rank and ligand inhibitor. Again, an important thing that you need to know, guys. Okay, monoclonal antibody. Then osteomalacia rickets. Here what happens basically, this is a rickets is seen in children where you see cupping fraying is playing, and osteomalacia is seen in adults, guys. So you need to supplement vitamin D, and a large amount is supplemented, that is known as STOS therapy. Okay, then coming on to the, guys, chronic gout and the acute, guys. If we talk about the acute gout, guys, we have NSAIDs. Okay, first of all, NSAIDs, colchicine and corticosteroids, guys. If you see here, guys, okay, we start with NSAIDs. If it does not respond, we go with colchicine or glucocorticoids, guys. If there is chronic gout, guys, we go with xanthan oxidase inhibitor like allopurinol, febuxostat, guys. Okay, we can also go with other drugs like rasburicase, guys. Okay, these are some other drugs that we use. So what is the history in gout, guys? Okay, so at the first tarsometatarsal joint, guys, okay, we have the gouty crystal. The image may be so that will have pain around the guide, swollen, inflammation, guys. This is again important thing that you need to know. Okay, then Burz's disease, guys. Okay, so this Burz's disease, guys, this is basically a vasculitis, guys. Okay, so this vasculitis basically narrowing of the vessels. So we need, it is associated with smoking, so smoking cessation is very important. Kawasaki disease, a disease that follows the cream criteria, guys, which we have already discussed last time, guys. Cervical rash, lymphadenopathy, edema, and other things, guys. Okay, so we can give intravenous immunoglobulin plus aspirin. Then you have giant cell arthritis, guys, more than 50 years, guys. You may have the history of headache ho gaya, guys. Okay, these are the things that you see in giant cell thing. So high dose glucocorticoid, guys. Okay. Then granulomatous with polyangiitis, guys, that is a Wagner's disease. So cyclophosphamide and glucocorticoid. Side effect of cyclophosphamide, guys, hemorrhagic cystitis treated by Messner. Then neural tube ka defect, guys, we require folic acid, guys, that is prenatal folic acid we advise, guys. Then migraine, guys. Okay, so migraine is a unilateral throbbing headache, guys, on one side. Okay, so migraine, we need to know the treatment and the prophylaxis. So treatment, we can use somatriptan and NSAIDs, guys. For prophylaxis, anti calcitonin gene related peptide like gpants and other things can be used, guys. Okay, idinomab and these things, receptor blockers can be tried. Trigeminal neuralgia. Okay, so along the distribution of trigeminal nerve, you have the pain. So while eating, the patient will complain of pain. This may be asked as your clinical STEM question. So here the treatment of choice is carbamazepine. Again, an important MCQ. Then multiple sclerosis, guys. Okay, when we talk about the multiple sclerosis, you might have already seen my mnemonic MS like US, guys. The mnemonic was your Donald Trump. This I have already discussed in one of my video, guys. So basically here you have dissemination in time, place. Okay, so when you have dissemination, guys, okay, so you have like Otto's phenomenon, guys, and various other things in Donald Trump. So basically here this is a beta interferon. See, beta interferon is for brain, guys. Gamma interferon for granuloma. Okay, again a frequently tested MCQ. Then tonic-clonic seizure. First of all, tone will increase, then it will go into clonic phase. That is, guys, you can give levetiracetam, phenytoin, valproate. Absence seizure, very, very important, guys. Ethosuximide MCQ. You may have a video-based question where the child would be looking. Suddenly, he turns blank, staring look. Okay, so that is your absence seizure. Then malignant hyperthermia. The drug of choice is dantrolene, guys. Okay. Then ADHD, that is attention deficit hyperactive disorder, guys. Okay, so basically here you can give behavioral therapy, you can give methylphenidate, other drugs. Schizophrenia, guys, atypical antipsychotics. Then anorexia, where you have lack of appetite. So nutrition may be, guys, psychotherapy can be tried, and selective serotonin reuptake inhibitor. Bulimia nervosa, again these all, guys, are the psychiatric disorders, guys. Okay, so again the similar treatment. Alcohol use disorder, guys. Okay, so basically here we want that they should develop an aversion to alcohol, guys. So the mnemonic is nota, that is none of the above. Okay, and for naltrexone, O for T for, guys, topiramide, A for acamprosate, guys. Okay, these are the things. Okay, so this is alcohol use disorder. Alcohol withdrawal, benzodiazepine. Bipolar disorder, suddenly you feel happy, at another moment you feel sad, so we need to use mood stabilizer like lithium. Depression, selective serotonin reuptake inhibitor. Serotonin will make you happy. Okay, so reuptake ka inhibitor, that is generalized anxiety, again the similar treatment, guys. Hyperaldosteronism. Okay, so spironolactone, because this is a aldosterone antagonist. Okay. Then say BPH, benign prostatic hyperplasia, guys. Okay, so BPH is common in male where there is prostate hyperplasia. Treatment of choice is TURP, transurethral resection of prostate, guys. Okay, so you can use alpha 1 antagonist, we can use 5 alpha reductase inhibitor like finasteride, we can use PDE5 inhibitor, guys. Infertility, guys, that is GnRH का pulsatile release और leuprolide may be used, guys. Okay, GnRH का example है. Infertility. Okay, then breast cancer in postmenopausal, guys. Here we use aromatase inhibitor like letrozole or anastrozole. Then ER/PR positive है, guys, that here we use tamoxifen in premenopausal age group. Uterine fibroid, guys, again we need to make the menses regular, so we'll give a gonadotropin releasing hormone, because if the GnRH will increase, it will suppress FSH and LH. As a result, menses will come into a regular thing. Prostatic adenocarcinoma, again the similar thing, guys. Okay, medical abortion, we use mifepristone plus misoprostol. Okay, this is again an important thing that you need to know. Then erectile dysfunction, guys, we'll use sildenafil. Then pulmonary artery hypertension, where the pressure increases more than 25. Okay, so we can use sildenafil, can be used epoprostenol. These are two other main drugs, guys. Okay, then mitochondrial inheritance, the disease which is inherited through the mother, guys. Okay, so if mother is affected, both males and females are affected. Inherited through females only, guys. Do you see? Then intellectual disability, that is your mental retardation. The new term is intellectual disability. So this Down syndrome and this Fragile X syndrome, guys. Okay, so basically these are the inherited cause. And what are the most common acquired cause of mental retardation, guys? That is your congenital hypothyroidism. Again, a frequently tested MCQ again and again in an exam. Okay, then coming on to your vitamin K deficiency. Okay, so vitamin deficiency, basically pregnant women are at high risk, guys. So basically, and folate also you give to prevent neural tube effect. Then lysosomal disorder, storage disorder, guys. We know that all the lysosomal storage disorders has except Fabry's and Hunter, guys. Okay, this is all of them are autosomal recessive except Fabry's and Hunter. Okay, which are X-linked, guys. Again, important, guys. So these are seen in male. And this Hunter, guys, you won't have any clouding of cornea. Again, important. Then HLA, DR3 and DR4. DR4 means 4 walls in a room. That is your rheumatoid arthritis, guys. Okay, and Addison disease and diabetes mellitus. Then HLA DR3, guys. Okay, you have Graves disease, Hashimoto's disease addition. This all the HLA has been discussed in one separate videos, guys, if you want to see. Then you have a bacteria that is associated with the gastritis, guys. You have peptic ulcer disease, guys. Gastric malignancy, that is your H. pylori. So H. pylori is stained with Warthin starry stain. Okay, and here we have certain toxins like Kage toxin, Vacate toxin, guys. Okay, and here we use triple drug therapy for treatment, where we use like clarithromycin, amoxicillin, or also we can use lansoprazole, triple drug therapy. Then opportunistic respiratory infection in AIDS, guys, already discussed. PJP, pneumocystis jirovecii, pneumonia, the trust ping pong wala thing. Helminth infection, guys, US, not so important. Viral encephalitis affecting the temporal lobe, that is herpes simplex ka ye. And if it causes meningitis, that is known as your molarate meningitis. Secondary to blood transfusion, guys, you can have hepatitis B infection. Okay, you can have syphilis and other things. So we need to screen it before we transfuse the blood. Food poisoning, guys. So S. aureus and Bacillus cereus, both of them causes food poisoning 1 to 6 hours, guys. But this S or Bacillus cereus is basically due to Chinese food ka history would be given, guys. This is very important. Then food poisoning, this was exotoxin mediated. Healthcare associated pneumonia, guys, that may be S. aureus, Pseudomonas, or other gram-negative infection. Bacterial meningitis less than 6 month old, guys, more than 6 months, that is a pneumonia. If we talk about less than 6 months, guys, remember 3 organisms: ZEL, G for group B streptococcus, E for E. coli, L for listeria. Let's check it out. Do you see, guys? So these are the things that is very important. Okay, and always remember this group B streptococci, B for baby. This causes meningitis in baby. Don't confuse between group A or group B. Osteomyelitis, guys, basically the infection of the bone, guys. So S. aureus is the most common, guys. If it is sickle cell, guys, that is salmonella for sickle cell. Drug abuse, guys, that is Pseudomonas or S. aureus. UTI, guys, most of the gram-negative organism like E. coli and Staphylococcus saprophyticus in sexually active women, guys. Saprophyticus, remember, sexually. Okay, then sexually transmitted disease co-infected with Neisseria gonorrhea, guys, that can be chlamydia trachomatis, already discussed. PID, guys, that is lower abdominal pain wala thing, guys. Okay, so you have the kit 6 wala, where we use CDM was the mnemonic, Cefixium, doxycycline, guys. Okay, and metronidazole. So okay, see, this was the mnemonic, guys, that is chlamydia trachomatis or Neisseria gonorrhea. Then metastasis to the bone, guys, that is prostate. The most common, that this was my ortho MCQ in my yesterday semester paper, guys. Okay, so this may be again tested upon. Mets to the brain, guys, that is your lung wala thing, most common to liver. Colon goes most commonly to the liver. Okay, S3 heart sound, guys. Okay, in ventricular filling pressure wala defect. S4 again a stiff ventricle, guys, like aortic stenosis. Okay, then holosystolic murmur, guys. Okay, we have in mitral regurgitation, tricuspid regurgitation, we have holosystolic murmur, guys. Okay, this is again very important, guys. Okay, then ejection click in aortic stenosis. Okay, then you have mitral valve stenosis seen in rheumatic heart disease. Opening snap in your mitral stenosis. Okay, and in your ejection click in aortic stenosis, guys. Okay, so remember how I have remembered, guys, I have remembered mitral stenosis as Mahendra Singh Dhoni, guys. Okay, so he can open up the match, guys. Okay, that is opening snap, guys. Okay, mitral stenosis. And this aortic stenosis, remember ASE. Okay, Asia, guys. Okay, like hai na, so that is aortic stenosis shows the presence of ejection click. Then heart murmur, guys, okay, congenital, seen in mitral valve prolapse, guys, okay. Then cyanotic heart disease, guys, like all the T wala, tetralogy of Fallot, transposition of great arteries, truncus arteriosus, total anomalous pulmonary venous return, tricuspid atresia. Then left cyanotic, all the other thing, guys, okay. See, when you say cyanotic, guys, this side is the normal blood wala thing, guys, okay. So if the blood comes from this side, guys, that is your cyanotic heart disease. If the blood comes from your left to right, guys, that is your acyanotic wala thing, okay. Then congenital cardiac anomaly, VSD, most common, guys, again MCQ that has been repeated so many times, okay. Then secondary hypertension that is not idiopathic, secondary to some other problem like renal artery stenosis, chronic kidney disease, guys, aortic aneurysm, okay. So Marfan syndrome causes aortic aneurysm, fibrillin 1 ka defect, guys, okay. And this can cause idiopathic cystic medial degeneration. Okay, that is cystic medial degeneration, guys. That is also known as Mockenberg sclerosis, if you remember your path. Then aortic aneurysm, that is abdominal wala thing, guys. That is due to atherosclerosis. Ascending or arch mein hai, that is your tertiary syphilis wala thing, guys. Okay, again important MCQ that may be tested, guys. Okay, then aortic dissection is due to hypertension, guys. Okay, chronic arrhythmia with no discrete P wave. P waves are not separated, that is atrial fibrillation. Okay, and this will increase the risk of emboli. Right heart failure due to a pulmonary, guys, very important, guys, code pulmonary. Infective endocarditis affect mitral valve more than aortic valve, guys. Okay, infective endocarditis associated with bacterium. Okay, so we have S. aureus, viridans streptococci, guys, subacute dental procedure, S. bovis already done colon cancer, gram negative organism like hackett, like hemobacterium, agricatobacter, cardiobacterium, E. cannella, Kingella, guys, okay, and culture negative, guys, Coxiella, very very important, guys, and Bartonella. Cardiac tumor most common in child, guys, that is rhabdomyoma. In adults, that is mets from somewhere else. Okay, then congenital hyperplasia and hypotension, guys. See, means first letter won't be 1, guys, okay. We have two options, 21, 11 and 17, guys. This two not possible, guys. That is only 21 hydroxylase. Now do you understand, guys, why did I discuss the mnemonic for this hydroxylase wala thing, congenital adrenal hyperplasia. Then hypopituitarism, that is pituitary adenoma. Congenital hypothyroidism, guys, okay. So basically the reason may be thyroid hormone dysgenesis, iodine deficiency, thyroid cancer. The most common is the papillary cancer wala thing, guys, okay. So this is again very important, guys. Papillary cancer, where you see face रहता है, but that is blank, that is not filled inside, orphan any eye nucleus. Then, guys, we have this are not so important. Then Cushing syndrome, guys, okay. So this Cushing syndrome, guys, okay, due to excess of glucocorticoid therapy, means you are increasing the cortisol, guys, okay. So this cortisol, increasing the cortisol, will cause all the problem related to steroid wala thing, guys, okay. So remember like that. Okay, then this is due to paraneoplastic, due to ACTS secretion by the tumor. Then you have tumor of adrenal medulla, guys, that is neuroblastoma malignant, okay, and adult pheochromocytoma already done, guys, and here you have rule of 10. Okay, now refractory peptic ulcer and high gastrin level, guys, that is your JDS, that is Zollinger-Ellison syndrome. Okay, then coming on to your esophageal cancer, guys, okay. So we have squamous cell carcinoma and adenocarcinoma, guys. Okay, this squamous cell carcinoma is the most common, guys, okay. And this squamous cell carcinoma, this is seen in middle 1/3, and this adenocarcinoma is seen in your lower 1/3. Okay, this adenocarcinoma is due to reflux, that is Barrett's esophagus, guys, okay. Then acute gastric ulcer associated with CNS injury, that is your Cushing ulcer, guys. Again, an important MCQ, guys, that you need to know. Okay, severe burns, guys, that is your curling ulcer. In burns, things shrinks, guys, that is curling, you curl down. Okay, bilateral ovarian mets from gastric carcinoma, guys, like Must-Nothing Krukenberg, which shows presence of signet ring cells. Nucleus is pushed to the side because it is filled with mucin inside, guys. Then chronic atrophic gastritis, autoimmune wala thing, it can predispose to gastric carcinoma. Then alternating area of transmural inflammation, guys, which is Crohn's disease, sister MAC. Already discussed, guys, T for transmural, guys, okay. See, site of diverticula, sigmoid colon meso, diverticulum in the pharynx, guys, that is a gincus diverticulum, guys, means where you have a defect in cricopharyngeus and thyropharyngeus, guys, okay. So you have a diverticulum there. diagnosed by the barium swallow. Already I think I discussed this in one of the videos. Hepatocellular carcinoma may be due to hepatitis B virus ka infection, or may be due to aflatoxin that is present in your groundnut. Okay, congenital conjugated hyperbilirubinemia. See, conjugated, only two options, guys. Doctors are conjugated. That is your Dubin Johnson or your Rotor, guys. But here you have given black liver, means dark color ka liver seen in Dubin Johnson. See, guys. Okay, then hereditary harmless jaundice, that is Gilbert syndrome, guys. Okay, that is partial UGT enzyme ka deficiency is there. Wilson disease, guys, that is ATP7B. Okay, beta, that is sun wala thing. Okay, here you have a defect of copper excretion into the bile, guys. Okay, and here it can go into the cornea, kidneys. This Wilson wala disease again important. This causes Wilson disease causes the sunflower cataract. Hemochromatosis, guys, due to multiple blood transfusion, as in cases of thalassemia. Here it is due to the HFE gene mutation, guys. Okay, that is present on chromosome number 6. It can cause bronze diabetes, guys. Okay, then pancreatitis, gallstone, alcohol, mumps. Okay, this all are the cause of pancreatitis. Pancreatitis chronic cause alcohol and cystic fibrosis. Microcytic anemia, guys, mnemonic is CETA. Sideroblastic iron deficiency, thalassemia, anemia of chronic disease, guys. Autosplenectomy is seen in your sickle cell anemia. Then see, bleeding disorder due to GP1B9 deficiency, guys, that is your Bernard-Solier wala defect. Okay, this Bernard, guys, if you see Bernard AD, that is platelet adhesion ka disorder, guys. Very important thing that you need to know. If you have GP2B3A, guys, that is GP4161 ka deficiency, guys. Okay, this may be also asked as your flow cytometry ka question, that is your glands and thrombocythemia, that is your aggregation ka. Bernard AD, that is adhesion disorder. Here Glanzman is, guys, glazing. Okay, glazing light. Okay, that is your aggregation ka defect. Hereditary bleeding disorder, von Willebrand disorder, factor 8 ke साथ which binds. Hereditary thrombophilia, factor 5 ka mutation, most common like mutation, this is seen. DIC, guys. Okay, disseminated intravascular coagulation, guys, in severe sepsis, trauma like APML, AML, M3, guys. Acute promyelocytic, already discussed now, guys. Trauma, major surgery. Malignancy associated with non-infectious fever, guys, that is your Hodgkin's lymphoma. Then type of Hodgkin's lymphoma, most common, guys, this nodular sclerosis is most common, and this shows the presence of your lacunar cells. Okay, then translocation 14-18, guys. Okay, so what is this, guys? That is your follicular lymphoma. Remember see, remember we have translocation 11, 14, 18, guys. Okay, so these two are located at the margin, so 11 and 18 will be marginal lymphoma, guys. Okay, 11 and 14, guys, that is mental. If you see, guys, E for 11 and 14 ka. F for follicular, F for 14. So follicular is 14, 18. Now see, translocation, now they have asked you 8 and 14, guys. Okay, that is, this 8 looks like B, that is your Burkitt lymphoma. Okay, this is again very important, guys. Okay, then see, you have non-Hodgkin's lymphoma, most common, guys, that is DLBCL. Okay, then see, the important thing is, guys, this translocation 922, that is seen in CML, Philadelphia chromosome, BCR ABL. Treatment of choice is imatinib, guys. Okay, now see, HLA B27, guys, the mnemonic is, guys, PAIER. P for psoriatic arthritis, A for ankylosing spondylitis, I for inflammatory bowel disease associated arthritis, R for reactive arthritis. Death in SLE is due to lupus nephropathy, guys. Okay, and this class 4 shows the presence of wild loop lesion. Okay, then giant cell arthritis, guys. Okay, risk of ipsilateral blindness, more than 50 years, ophthalmic artery का involvement हो सकता, polymyalgia rheumatica हो सकता. Okay, this is again very simple thing that you need to know. Then do you have recurrent inflammation of the small to medium size, that is your Burz's disease, strongly associated with alcohol, smoking, so you need to stop the smoking. So treatment is smoking cessation. Tumor of infancy, that is strawberry hemangioma, guys, that regresses by childhood. Actinic keratosis, that is your pre-malignant lesion for your squamous cell carcinoma. Herald page, guys, that is seen in pityriasis rosea, that is caused due to HHV6 more than HHV7, and this causes the presence of herald page and the Collarite scale, and this is distributed in Christmas tree, inverted Christmas tree ka pattern. Then cerebellar tonsillar herniation, it has come down, that is Chiari malformation. Atrophy of the mammillary bodies, guys, that is your Wernicke-Korsakoff syndrome. Very, very important, guys. This is so frequently repeated. Epidural hematoma means above the dura something has ruptured so that it separates off, that is your middle meningeal artery ka. Subdural guys, okay, below the dura guys, okay, so subdural guys you have the breathing vein guys, that is your crescent shape. So how I remember subdural guys, that is banana shaped ka. Okay, remember like this guys, okay, that is your banana shape, that is your subdural wala thing. Epidural hematoma will be your lentiform shaped. Dementia, basically memory loss guys. Most common cause is Alzheimer's disease. Also it may be vascular dementia, pig disease, Lewy body dementia. Then demyelinating disorder in a young woman, that is a multiple sclerosis. Okay, then see, we have other important things like guys. Then coming to mixed UMN and LMN motor disease, yeah guys, this is very important, that is your amyotrophic lateral sclerosis. Then glomerulonephritis in adult, IgA. A means adults, A means all over. Okay. Then nephrotic syndrome in adult guys, that is a membranous nephropathy. In children guys, that is MCD. Child have not changed guys, just one minimal change disease. Then kidney stones guys. Calcium stones is radio opaque stone guys. Okay, so we have calcium stone which can be either a envelope shaped stone guys. This is important. Okay, calcium oxalate monohydrate or dihydrate guys. Okay, we have monohydrate and dihydrate guys. Okay, so this is important that you need to know. Then strovite stone guys, that is a radio opaque stone that is due to a urease positive organism like Proteus. Okay, this is again important. Then uric acid is a translucent stone guys. Okay, so like xanthin acid, uric acid, indanavir acid, extreme UTI is the mnemonic, that is radiolucent stone. Okay, then renal tumor, renal cell carcinoma, if it is associated with VHL 3 letter, that is clear cell carcinoma guys. Okay, and paraneoplastic syndrome like erythropoietin renin secretion guys. Primary amenorrhea guys, Turner syndrome, streak ovaries guys, again we have already done guys. Widely spaced nipple amenorrhea. Okay, you have neuron ka migration failure guys, that is Kalman syndrome. Here you have anosmia means problem in smelling will be given in the history. Clear cell adenocarcinoma of vagina, that is diethylstilbestrol ka exposure. Ovarian tumor guys, benign है, bilateral है. Okay, that is your serous. Okay, cyst adenoma. If they have given you malignant, that is your serous carcinoma guys. Okay, there you have given bilateral. If it would be unilateral guys, that would be mucinous cyst adenoma. Okay, then tumor in women guys, this leiomyoma or the fibroid, which is a hormone dependent tumor, hence it regresses after the menopause. Gynecological malignancy, endometrial carcinoma may be seen. Breast mass guys, fibrocystic disease. Then you have guys, what is important here, this is hypercoagulated endothelial triad and blood stasis, that is known as your virtuous triad guys. Okay, pulmonary hypertension guys, already done. SIADH guys, that is small cell lung cancer guys. So okay, so how I have remembered the paraneoplastic? S for SIADH guys, L for Lambert-Eaton, a neurological disorder, and C for Cushing syndrome guys. This is very important paraneoplastic syndrome that you need to know for your small cell. For squamous cell guys, it's hypercalcemia. Okay, that is due to parathormone gene related peptide guys. Okay, this is again very important thing that you must know, you cannot forget it out guys. Okay, see, now coming on to few formula that you need to know guys. Okay, talking about the formula guys, see, we have volume of distribution, means it is the amount of drug that would remain in the plasma if it would were to distribute throughly. Okay, so we have formula is guys, amount of drug by plasma drug concentration. Then T half guys, that is 0.7 into volume of distribution by clearance. Okay, then the important thing is this one guys, that is therapeutic index, TILE. Mnemonic is L for lethal dose and guys E for effective dose. Okay, odds ratio used for case control study, that is cross product ratio, AD by BC guys. Okay, then you have the relative risk guys. Okay, so see, we have made a table guys so that it makes it easy to know guys. Okay, so it's basically incidence among exposed guys. These are the people who smoke, so A plus B are the people who smoke. Out of that, lung cancer is present in A, so A by A plus B. Non-smoker who do not smoke but has a lung cancer, so C is the people who has lung cancer but do not smoke. Out of the total non-smoker, that is C plus D. That is incidence among exposed by non-exposed. Attributable risk is equal to incidence among exposed minus non-exposed. Then we have sensitivity and specificity. Out of the people, sensitivity is the ability of a test to determine who all are positive guys. Specificity is the ability of a test to determine the negatives. Okay, so that is true positive by true positive plus false negative guys. See, if we try to do, guys, this is true positive, guys, this is true negative. Okay, see, then these are the people who smoke, but they do not have the lung cancer, guys, so that is your false negative, guys. Okay, means I am trying to explain in this graph, guys, so just bear with it. We will not make it again, you guys make it again, guys. Okay, when it comes in the exam, so always try to make it, guys, that will make it easy, guys. Okay, see, when you do like this, guys, that is sensitivity, that is true positive by true positive plus false negative, guys. Specificity is true negative by true negative plus false positive. Then positive predictive value, out of those who tested positive, how many are actually positive, guys. Okay, so that is your see, you see both the positive come here, guys, here both the negatives come, but if you see sensitivity and specificity, one is positive, one is negative, guys. Okay, then cardiac output is equal to heart rate into stroke volume. Then mean arterial pressure is equal to 2/3 of diastolic, 1/3 of systolic. This may be asked to calculate, guys. Stroke volume is equal to end diastolic minus end systolic. So that is normal 120 ml and systolic is normally 50 ml, guys. That comes out to be 70 ml. If you calculate this, guys, okay, heart rate is around 72, you can assume, and stroke volume is 70. That comes about to be cardiac output to be around 5000 ml. That is approx 5 liter is our cardiac output. 5 liter. Okay, then say clearance, urine concentration in, okay, into volume by plasma concentration, guys. Okay, then filtration fraction, that is glomerular filtrate rate by the renal plasma flow. Then FEN, fractional excretion of sodium, guys, that is less than 1 in pre-renal and more than 1 in renal cause. Then you have a Henderson-Hasselbalch equation, guys. Okay, so pH is equal to P 6.1 plus log SCO3 minus by 0.03 PCO2, guys. So this was all about the equation that may be asked, like as a solve the numerical based question may be asked, guys, here. Okay, then coming on to some drugs which have almost similar name and that you can get confused, guys. Amiloride, guys. Okay, so that is a potassium sparing diuretic. Amiodarone, guys. Okay, so this is the drug, guys. Okay, where you see this is a class 3 anti-arrhythmic drug, guys. Amiodarone, again an important thing that you need to know, this will cause pulmonary fibrosis wala thing. Okay, then amlodipine, guys. Okay, so amlodipine is a calcium channel blocker. Then benzotropine, guys, try to recall where we heard in cholinergic antagonist, that is this one was used in Parkinson disease, guys. Bromocriptine dopamine agonist, now only we read this is used in prolactinoma. Then you have buspirion and bupropion, guys. This bupropion, this is not so important. Cimetidine, guys, H2 receptor ka antagonist, guys. This is again important. Cetirizine, guys, when do you use cetirizine, guys? When you feel like allergy wala thing, that is antihistaminic second generation, so it will not cause sleeping issues, that you will feel sleepy after eating a tablet. Chloramphenicol, guys, this is the antibiotic wale chapter se, so this is blocking the 50S subunit. Okay, then you have chlordiazepoxide, that is long acting benzodiazepine, not so important. Then chlorpromazine, guys, that is a typical antipsychotic. Then chlorpropamide, this drug has been banned, guys, that was a first generation sulfonamide. We have tolbutamide and chlorpropamide. Okay, then chlorpheniramine, again an antihistaminic, guys. Chlorthalidone, guys, this is a thiazide diuretic. Clozapine, again an antipsychotic. Clomipramine, again a antidepressant. Clomiphene, guys, that is used in ovulation induction wala drug, guys. Okay, that is selective estrogen receptor modulator. Clonidine, guys, used as a alpha 2 agonist drug. Then we have, guys, eplerenone, again a potassium sparing diuretic. Potassium sparing diuretic, guys, that is eplerenone, amiloride, guys. Okay, and propafenone, guys, that is class 1C antiarrhythmic, guys. Okay, then fluoxetine, selective serotonin reuptake inhibitor, guys. Then this too is very important, mifepristone and mifepristol, guys. Mifepristone is a progesterone receptor antagonist, while this misoprostol is a PGE1 synthetic analog, guys. Very very important. Then naloxone, guys, this is a opioid antagonist, guys. This is one of the frequently repeated MCQ. And this naltrexone, guys, okay, this is basically, this treats the toxicity, opioid ka toxicity, and to prevent the relapse, guys, we have naltrexone, like nota wala drugs, acamproside, topiramate wala drugs. Then nitroprusside used in your hypertensive emergency. Sublingual nitroglycerin, angina ka drug, we know guys. Omeprazole, lansoprazole, rubiaprazole, all of them are PPIs, proton pump inhibitor. Ketoconazole is an antifungal drug guys that inhibits the fungal sterol ka synthesis. Aripiprazole guys, okay, that is again an antipsychotic. Then you have anastrozole guys, letrozole, anastrozole, already right now, that is a aromatase inhibitor. Then rifaximin guys, this is used for hepatic encephalopathy, very important guys, because it decreases the amount of ammonia going to the brain guys. Okay, so this is important. Rifampicin guys, that is the antimicrobial like which is used in TB, leprosy guys. Okay, DNA dependent RNA polymerase inhibitor guys. Then you have salagilin, rasagilin, that is a MAO-B inhibitor that is used in your Parkinson disease guys. Okay, then this tramadol guys, that is used in chronic pain, which is a weak opioid, so as a result dependence will be very less, and this gives a great amount of pain relief. Then these two drugs have been also tested in exam. One is the varenicline guys, that is used for smoking cessation, that is again an important MCQ. Then venlafaxine is a serotonin norepinephrine reuptake inhibitor, that is a venlafaxine. So this was all about your some common medication. So we have read till now many of the pharmas, path, micro, many things like we have tried to inculcate here and there guys. Okay, see, now coming on to your pressure volume ka curve. Okay, we'll be discussing the most important curves that you need to know guys. Okay, before discussing the curve guys, okay, first of all let's have a brief look at your cardiac cycle guys. Okay, unless and until you are good with your cardiac cycle, it's very difficult to answer this question guys. Okay, see, the reason for only writing it down guys, okay, so that when you want you can revise it down guys. Okay, because everyone speaks and when you want you don't have a written notes guys. Okay, so this cardiac cycle has been explained in so detail guys. See, when you talk about the phases of the cardiac cycle guys, see, first we'll see this cardiac cycle, then we'll come to phases wala thing. See, first of all atria is contracting guys, try to visualize. जब एट्रिया कॉन्ट्रैक्ट कर रहा है तो प्रेशर इन द एट्रियम इंक्रीजेस गाइस. ओके, सो ब्लड विल गो फ्रॉम द एट्रिया इनटू द वेंट्रिकल्स. हाउ? पहले valve will open. Which valve will open guys? So between atrium and ventricle we have tricuspid and bicuspid valve. Okay, bicuspid which is also known as mitral valve. So when the valve open, so blood now starts coming from atrium to the ventricle guys. Okay, so when blood has come here guys, okay, so now ventricular will contract, ventricular systole guys. Okay, so intraventricular pressure. Okay, now blood is there in the ventricle, so intraventricular pressure increases more than the atrial pressure. When it is more, what will happen guys? Till now the valve through which blood was coming, that is bicuspid and tricuspid, will now close guys. Okay, and the blood is in ventricle. So when this close guys, that is your first heart sound, that is your S1. Okay, now see, so what happens? There is a closer. So when it closes guys, there is a little bulging of the mitral valve, that is bicuspid valve guys. Okay, causing a slight increase in your left atrial pressure. Okay, now see, now what happens? The backward valves are closed, means tricuspid and bicuspid valves are open, yet the pressure is not so high that your aortic and pulmonary valves are open. Okay, so this ventricular is contracting as a closed chamber guys, without any change the volume. All the blood that has to come in the ventricle has gone. Okay, and the backward valve is closed and the forward valves are closed. So it's not going anywhere guys. So this state is known as isovolumetric contraction. Okay, so isovolumetric contraction. So now the ventricle so this is isovolumetric contraction. When the pressure increases guys, ventricular pressure to 81 mmHg, what happens? Now the valve will start to open. Okay, aortic and pulmonary valve open. This is known as your ejection click wala thing guys. Okay, that was seen in aortic stenosis guys. Okay, if you remember. Okay, now see, now when it opens guys, so what will happen? Blood will go into aorta and pulmonary artery through the ventricles guys. That is your rapid ventricular injection. When there is more blood, it goes very quickly. Now some amount of blood, it will go slowly, that is a slow ventricular ejection. Now the blood has started to eject out guys, so ventricle will have less blood, so ventricle will start relaxing guys. So intraventricular pressure will fall guys as blood has gone out. So the ventricular pressure, okay, becomes less, okay, than the pressure in the aorta and pulmonary artery. Okay, so so this ventricular pressure becomes less in the aorta and pulmonary arteries. So what happens guys, due to the ventricular pressure becoming less, aorta and pulmonary valve closes, that is your S2. Okay, now see, even though pressure in ventricle is decreasing guys as blood has gone, but it is very high, still high as compared to the pressure in the atrium guys. Okay, so this ventricle is now relaxing as a closed valve guys. Okay, that is your isovolumetric relaxation guys. Okay, now see, during this phase, that atria is behaving as a reservoir of blood. Why? Because the bicuspid and tricuspid valves are open, so the blood is going and filling there. Atrium is behaving as a reservoir of blood, and the ventricles are still relaxing guys. Okay, now the pressure in the ventricle start dropping until it reaches the point where the pressure in the ventricle become less than the pressure in the atrium guys. Okay, when the pressure becomes less guys, now what will happen? Mitral and tricuspid valve will open. That is known as the opening snap. So blood will come out from atrium to the ventricle guys. So first we have rapid passive filling, then we have slowly progressive filling guys. Okay, so if we see guys, सबसे पहले what happened, mitral valve open हुआ ताकि blood comes inside the ventricle guys. Okay, after the blood came inside the ventricle guys. Okay, so then you have the closure of your mitral and tricuspid valve. So first heart sound S1 was heard guys. Okay, now see, the backward valves are closed, forward valves are closed, blood आगे नहीं जा रहा है. Okay, so that is behaving as a closed chamber. That is your isovolumetric contraction. अब क्या हुआ? Now the aortic valve open guys. Okay, to move the blood out guys. Okay, so valve will open to move the blood out, तो injection हुआ blood का guys. Okay, now ejection हुआ guys. So as a result क्या हुआ? Now aortic and pulmonary valve closed. That is your S2 heart sound. Now ventricle is relaxing as a closed chamber. Okay, because the blood is going to the atrium but not coming to the ventricle since the valves are closed. That is your isovolumetric relaxation guys. Okay, when the pressure decreases, valve open हो जाएगा, blood will come down. So this was about your cycle. So see, we have first of all atrial contraction, then you have isovolumetric contraction, then rapid ventricular ejection, then rapid slow ventricular ejection, isovolumetric relaxation, rapid passive filling, slow passive filling guys. Okay, now come, let's see this cycle guys. Okay, let's see how easy it becomes. सबसे पहले what happens guys, mitral valve open guys. Okay, means till now the blood was in atrium, mitral valve will open to increase the blood in the ventricle guys. Do you see? The volume of the blood increases. Do you see guys? Because the blood is coming to the ventricle when the valve open. At a time when all the blood will come guys. Okay, so mitral valve will close because now the ventricle has the blood. So now what happens? The ventricle has the blood, but the aorta and the pulmonary valves are not open guys. Okay, so that is isovolumetric contraction ka phase. Okay, now see, after a time guys, isovolumetric contraction will end guys and the aortic valve will open. The time when the aortic valve open, blood will go out. So as a result, ventricle mein blood volume will decrease. Do you see guys? Ventricle ka blood volume decreases. Okay, at a time it will get empty. Okay, so the volume will come, aortic valve will close at a time guys. Okay, then again the blood is going to the atria but not coming down. That is your isovolumetric relaxation. Okay, see, and this is the systolic volume, this is the stroke volume guys. Okay, the difference between the two. If you see guys, stroke volume, what is the formula? N diastolic minus N systolic. What is the diastolic guys? That is 50. Okay, systolic is 50, diastolic is 120 guys. Okay, so this point is your end diastolic ka point, this is your end systolic ka point guys. Okay, 120 minus 50, that is your 70 ml. Okay, again important, this one is your systolic BP guys, this point is your diastolic BP. Okay, this just to know the marking guys. Okay, this is your systolic and this is your diastolic guys. So this was about your cycle guys that you need to know. Okay, now see, now check out this one guys. Okay, so mitral valve first of all open, the volume is increasing guys, then mitral valve closed, then it is contracting as a closed chamber guys. That is your isovolumetric contraction. Now the volume will decrease guys. Okay, so here what happens guys, here you will have aortic valve ko opening, here you will have aortic valve ko closer guys. Okay, so this is all about the thing that you need to know guys. See, this we have already seen guys. Okay, then second guys, you have this graph guys. Okay, which looks like a very typical, very confusing graph guys. Okay, so see, this is basically all the event guys that is happening in the cardiac cycle wala only thing guys. If you have understood that clearly, this is very easy guys. Then reading a bit about the JVP guys. JVP, you have the A wave guys. A for atrial contraction. This is absent in atrial fibrillation. Again, a very important thing that you need to know guys. Okay, Then C wave guys, C wave basically A, C, V are the ascent wala thing and X and Y are the descent wala thing guys. C wave is for contraction of the right ventricle, okay, that is closed tricuspid valve bulging into the atrium, okay. JVP basically tells about your right side of the heart guys, okay. JVP, that is very important. Then you have X descent guys, okay. So this X descent is the atrial relaxation and downward displacement of closed tricuspid valve. Then V wave guys, V wave is due to increase in volume guys, okay, that is again important. Y descent, that is right atrium is now emptying into the right ventricle. Okay, now see, these are the important pressure volume loops that you need to know guys, okay. So this has been taken from the first aid or pressure volume loop guys, okay. So first of all, reading that guys, before first we'll read a bit about the preload, afterload. Then first let's understand a bit concept, then we'll see how can you easily remember it guys, okay. So preload is the volume of the blood received by the heart guys. Basically this preload is your end diastolic volume guys, you need to know. Afterload is the pressure or the resistance against which the heart has to pump so that blood goes out. So afterload is the squeeze. Preload is the volume of blood at the end of the diastole guys, that is the stretch due to the blood filling aside, that is your end diastolic volume, okay. See, so see, this we have already done guys. End diastolic is 120 ml, systolic is 50 ml guys. So stroke volume is 70 ml, end diastolic minus systolic guys. Cardiac output, heart rate into stroke volume, that is your 5 liter guys. Already done. Now see, let's have a look at this graph guys, okay. What does this graph tell you guys, okay. So see, how can you remember? See, first of all, try to understand this one is the stroke volume guys, okay. Here the new graph they have given you is this one, means stroke volume has increased guys. Look at this graph guys. Initially this was the stroke volume. Now what happened? The stroke volume has reduced. Look at this graph guys. Now they have given you this graph dotted wala, that is stroke volume has increased. Okay, now see, we have preload, afterload and contractibility guys. Preload is basically preload was basically the stretch guys, okay. Afterload was the squeeze guys. Contractibility, the contractile power or the ionotropy of the ionotropy, okay. Now you see, how do you remember guys? Preload means P after PR is coming, so if the graph shifts towards the right, that is preload they have tried to show you, okay. Afterload guys, FT, that is on the front or the top, if you remember guys, the graph shifts to the top guys, that is your afterload. Then contractibility guys, contractor left the job, that is if the graph shifts toward the left guys, that is your contractibility. Now see, this thing is very important. This stroke volume is directly proportional to your end diastolic volume and inversely proportional to your end systolic volume, okay. We already said preload is equal to end diastolic volume, okay. So if the preload increases guys, okay, what will happen? End diastolic volume will increase, therefore stroke volume will increase. Now think about afterload guys. If the stroke volume reduces, means end systolic volume will increase guys. Do you see? Okay, then ionotropy means contractibility guys. If the stroke volume increases, this will reduce because they both are in your inverse ka relationship guys. This is important that you need to know guys. See, this is a question if they ask you guys, this was the original, this blue one is the new one, so this is shift over the right, means the preload has बढ़ गया और stroke volume, as you can see in the image, this increases. If you see this one guys, okay, so this has gone up, means front or top पे गया है, that is guys afterload has increased but the stroke volume has decreased. Okay, now see how this knowledge will help you make this graphs easy guys, okay. So see, first of all, I'll try to make it easy guys, okay. Then first I'll try to explain you guys, okay. Then I'll give you mnemonic so that you remember it guys, okay. Now see, aortic stenosis guys, think for yourself guys. This is the aortic valve guys. There you have the stenosis, means blood is not able to go from left ventricle to the aorta, so less amount of blood will go guys, that is the stroke volume will decrease, okay. So less amount of blood will go, stroke volume decrease, as a result blood कम बाहर जा रहा है, that is at the end of the systole volume ventricles में will be more, that is end systolic volume increases, and due to repeated this there will be left ventricular pressure increase leading to left ventricular hypertrophy guys, okay. Now coming on to aortic regurgitation guys, okay. See, this is the aortic valve. Here the blood is regurgitating back guys, okay. So regurgitating back guys, so as a result what will happen, that at the end of the diastole volume बढ़ जाएगा, that is increase in end diastolic volume, and stroke volume will also increase. Now coming on to the mitral valve stenosis, guys. Means blood will not come from left atrium to left ventricle, less blood will come. So less amount of blood in the left ventricle, so it will pump also less. As a result, stroke volume come ho gaya. When there is less amount of blood to pump, less amount will remain also because lessers come also. That is your end systolic volume bhi kam ho gaya. Okay, ejection systolic volume bhi kam ho gaya. And end diastolic volume is also decreased because of impaired ventricular filling. All the three decreases. Then mitral regurgitation, guys. The blood is regurgitating back into the left atrium from the left ventricle, guys. As a result, what happened, guys? Ejection systolic volume decreases, guys. Okay, and stroke volume increases, guys, because there is a forward flow into the systemic circulation. Now see, how can you remember it, guys? Remember this aortic stenosis, guys. AS. Okay, remember this aortic stenosis is afterload wala graph. So what happens in afterload? That is the graph goes into front and top and stroke volume decreases, guys. Do you see? The same graph that we read in afterload wala thing. Now coming on to aortic regurgitation, guys. Okay, aortic regurgitation, the graph looks like a R is formed, guys. Do you see? That is your aortic regurgitation ka graph, guys. Okay, then mitral stenosis, the mnemonic was there, Mahendra Singh Dhoni, guys, opening snap wala thing. Mahendra Singh Dhoni has left cricket now. Okay, so the graph has shifted towards the left. Do you see, guys? Instead of being here, the graph has shifted here, guys. Then mitral regurgitation, MRI, guys. Okay, so MRI is a machine, guys. Okay, that looks like this, guys. A hole is there, and here the patient is made to sleep, guys. So this looks same like your mitral regurgitation, guys. So I think this makes it very easy. See, concept is important, guys. But at the end moment during your exam, you need to identify the answer. If you are not able to do, the entire concept goes in vain, whatever you have read over the past 4 and 5 years, guys. So you need to know the crux, guys. Okay, so aortic stenosis like a afterload wala thing. So graph will goes front and top and stroke volume will decrease. Then aortic regurgitation, guys. Okay, so in aortic regurgitation, what AR, that is right type ka it will be made. Mitral stenosis, Mahendra Singh Dhoni is left cricket, so it will go slightly toward the left wala thing, guys. Mitral regurgitation like a MRI machine, so a whole circular. See, if you see one more thing, guys. Okay, in stenosis wala thing, guys, less blood is going, guys. As a result, stroke volume is decreases. Do you see? It has come from here to here instead from here to here. Here you see, instead of here, it has come. So if the stroke volume is reduced, the answer will be in some stenosis wala thing, guys. Okay. If not so, it will be in regurgitation ka thing. I think this also makes it easy to identify this type of question, guys. Okay, so that you don't make mistakes, guys, here. Okay, now coming on to the see, this is already discussed cardiac cycle wala phase, and now coming on to your flow volume loops in your lung car disease, guys. Okay, see, this is very easy, much easier than your cardiac cycle wala thing, guys. Okay, so now see, if we talk about the obstructive lung disease, basically there is an obstruction to the bits. So here what happens, FeV1 by FeVC decrease, guys. Okay, this is important. Decrease FeV1 by decrease FeVC. Now, guys, your restrictive lung disease, guys, what happened? This is normal or increase because there is a proportionate decrease, guys. Okay, now see, you need to know about your obstructive ka graph kaisa dikhega and restrictive kaisa dikhega. First of all, see, guys, this is the normal graph, guys. Okay, here what you see, guys, that is your expiratory ka phase. This is your inspiration ka phase. Okay, now see, restrictive shifts towards the right, guys. No confusion, means obstructive will shift towards the left. Also, when you are in an obstruction, guys, you look like Bhagwan ne mujhe kyun problem diya. That is why someone has scooped out of me something, guys. Okay, which I had. Okay, why I had less opportunities, guys? That is scooping out. Okay, so that is seen in your obstructive. Okay, now see, looking at this graph, this obstructive, this was the normal thing, guys. Okay, and this graph, this was the normal thing. This graph has shifted towards the left, guys. That is your obstructive. This graph has shifted towards the right. That is your restrictive, right? Okay, then do you see, guys, the top one, guys, was the expiration wala. This one was the inspiration wala. Okay, what happens? This has come down, guys. Okay, so basically what happens here, guys, this expiratory wala thing has come down, guys. Okay, so basically this is an intrathoracic obstruction. Okay, remember, agar expiratory has come down, that is intrathoracic obstruction. Here you see what happens. Here the inspiration has gone down, guys. Okay, so that is a extrathoracic obstruction, guys. Okay, here see, both has come down, so this is a fixed wala graph. Okay, now looking at one more photo, guys. Look at this, all of them will be clear, guys. So this is normal, guys. Expiratory, inspiratory. Here you see the scooping out, that is obstructive. A scoop has been taken out. Okay, now coming on to this one, guys. Fixed straight line on both sides, that is fixed. That is in your tracheal stenosis, laryngomalacia, foreign body, guys. Okay, then coming on to this one, guys. What happened here? Inspiratory ka loop is blunting, means there is a opposite we need to go, matlab extra thoracic ka obstruction hai. Here expiratory is blunted, means intrathoracic ka obstruction hai, guys, like a tracheal tumor. Here like a your vocal cord palsy, guys. Okay, so this is again important that you need to know, guys. Okay, this was about your respiratory ka graph. Now coming on to the next one, guys, that is your Darrow-Yannet diagram, guys. Okay, so basically this is about your concepts in physio, guys. Okay, so if you know, it's very easy, guys. So this is basically a summary of all the shock and other diarrhea, dehydration, whatever we have read till date, SIADH wala thing. Okay, so first of all, see, guys, what happened. So for volume regulation in the body, there are two main poles of the body. One is the aldosterone that increases the salt water retention. One is the antidiuretic hormone ADH, as an antidiuresis, means prevents the loss of water, means increases the water. If we see, guys, this side is the graph of osmolality, okay, and this side is the volume. Okay, and two-third is the ICF volume and 1/3 is the ECF volume. Okay, now see how does volume regulation takes place. So what happens if there is a decreased perfusion to the kidney, means less amount of renin. Okay, so decreased perfusion will increase the renin, which will stimulate the renin-angiotensin last stimulator. Then factors regulating the aldosterone wala thing, guys, again important. And your ADH, how does it act, we already know, guys. Okay, now suppose we see the example, guys. Okay, see, we'll see the example how the effect takes place, guys. That is important. First of all, see this example, guys. If you look, guys, what happened, this was your, guys, ICF ka volume, this was your ECF ka volume. Matlab both the volume has decreased. ICF में decrease हुआ है, ECF also has decreased, guys. Okay, and serum osmolarity has decreased. matlab body water कम हुआ. As a result, what happens, due to decrease in body water, osmolarity बढ़ गया, because in less amount of water, same amount of solute will occur concentrated, guys. When will this happen, guys? We are trying to lose water, that is in dehydration, in sweating. Okay, and diabetes insipidus. What happens in diabetes? There is decrease in ADH. Means ADH prevents the loss of water. When there is decrease, more amount of water will be lost in urine. As a result, what? Body water will decrease. As a result, osmolarity will increase, guys. Okay, this is very easy now, guys. Now seeing the next one, guys. See what happens here, guys. Here the ECF has decreased, guys. Okay, and this ECF has decreased, guys, increased. Okay, and osmolarity is increased. Now think of the scenario, guys. Here ICF has decreased, ECF has increased, and osmolarity has increased, guys. Okay, and if you see, guys, there is always a relationship, guys. Okay, this ICF and osmolarity, guys, they go opposite, guys, if you need to have a change, guys, because that's how maintenance takes place. Okay, so basically water, what happens in the extracellular compartment, guys, water is increased, guys. Okay, so this will be when you have taken a hypertonic fluids like hypertonic saline, hypertonic mannitol. This is again important, guys. Okay, now seeing this one, guys. ICF का volume increase, ECF का volume increase, ICF का बढ़ा, means serum osmolality has to decrease, guys. Okay, now see. Here the serum osmolality has decreased, but the extracellular fluid का volume intracellular, means पूरे body में water you have increased, means you can increase ADH, you can increase the water intake, guys. That is your SIADH हो गया, primary polydipsia हो गया, beer protomania हो गया. These are the things where you see this type of graph. Now coming on to this one, guys. Here osmolarity has no change, guys, means ICF will show no change, and ECF has increased, guys. Extracellular fluid has increased, and osmolarity का कोई change नहीं, means you have given something isotonic, guys, which is same concentration as that of plasma. So infusion of isotonic fluids like saline you have given, guys. Okay, colloids you have given like dextran. Okay, and you have basically primary aldosteronism like Conn syndrome. Now seeing this one, guys, what happens in this graph, guys. Here what happens, guys, this ICF has increased, ECF has come down, Okay, and the serum osmolarity, guys, this serum osmolarity, guys, has also come down. Okay, so basically this is due to Addison disease, guys, where there is a decrease in aldosterone, so decrease sodium water retention, guys. Okay, as a result, due to loss of the sodium, guys, extracellular fluid ka volume decreases, guys. Okay, intracellular ka it increases, guys, and serum osmolarity decreases, guys. So this is about your Addison disease ka graph, guys. Now see, we'll be summarizing once again, guys, so that you don't have any confusion in this your Darrow-Yannet diagram, guys. See, gain of isotonic fluid, same fluid ka you are gaining, guys. So how will you gain it, guys? If you have saline ka infusion, guys. Okay, so isotonic matlab you have no change in ECF, guys. Matlab you have no change in osmolarity. If you have no change in osmolarity, ICF ka volume will also not change, and you have given the fluid. As a result, ECF compartment ka volume increased. Okay, now see, now loss of isotonic fluid. So loss may be in the form of diarrhea, vomiting, hemorrhage. Okay, so basically the same concentration का loss. तो मतलब osmolarity no change, guys, osmolarity. As a result ICF में change नहीं होगा, but loss तो हो रहा है. That is ECF will decrease, guys. Okay, now coming on to gain of hypotonic fluid like SiADH, guys. Think, guys, increase in ADH तो पूरे body में salt water का retention हो गया. तो retention, so both of this will increase. Okay, ECF, ICF both will increase, guys, but what will happen, because due to increase in water, guys, osmolarity कम हो जाएगा, that is decreases. Now loss of hypotonic fluid like in sweating and diabetes insipidus, guys, what happened, there is a deficiency in ADH कम हो गया, that is it will increase the loss of water. As a result ECF and ICF दोनों का volume decreases. Okay, as a result concentration looks to be high, that is serum osmolarity increases. Gain of hypertonic fluid like excess NaCl if you have given, guys. Okay, excess hypertonic fluid, so ECF will increase, ICF will decrease, guys, and if ICF decreases, serum osmolarity increases, guys. Okay, you can remember like this, serum osmolarity is inversely proportional to ICF volume. Now see, loss of hypertonic fluid like adrenal insufficiency Addison disease, guys. तो aldosterone कम हुआ तो there is a loss of sodium, guys. As a result क्या हुआ, serum osmolarity decrease हो गया, and this decreased serum osmolarity forces मतलब fluid to move from ECF to ICF, guys. तो ICF बढ़ गया. Now see, let's take one example, guys. If we take this example E वाला, what happens, do you see, guys, ICF also कम हुआ मतलब बॉडी से वाटर लॉस हुआ, ECF also लॉस हुआ, guys, बट सीरम ऑस्मोलैरिटी योर ऑस्मोलैरिटी इंक्रीजेस, मतलब टोटल बॉडी से वाटर तो लॉस हुआ बट योर ऑस्मोलैरिटी हैज इंक्रीज, गाइस, मीन्स दिस इज ड्यू टू योर स्वेटिंग और इट मे बी ड्यू टू योर डायबिटीज इंसिपिडस. नाउ टेक वन मोर एग्जांपल, guys. What happens here? Okay, here what happens, guys, your here what is happening, guys, your ECF is increasing, guys, ICF is decreasing, guys. Okay, ICF is decreasing, guys, ECF is increasing and serum osmolarity is increasing. So serum osmolarity is increasing means hypertonic solution आया है, that has increased the ECF वाला thing, guys. Okay, this is again important, like excess NaCl intake. So this is about all your graph that you need to know, all your Darrow-Yannet diagram, guys. Okay, just have a look at the graph once and I think hope this makes it easy, guys. If you like it, guys, please do comment, like, share and subscribe. Do comment which topic you need the most for your rapid revision. I'll try to inculcate in the next video, guys. Hope you like the video. Please comment, like, share and with your friends. Enjoy learning, happy learning, all the best for your exams.